All right, so we're diving into a story today that's, well, it's true crime, but also kind of unsettling commentary, I guess, on healthcare in America. Brian Thompson, CEO of UnitedHealthcare, was murdered. And not just, in some random act of violence.
Yeah.
This was in broad daylight, Midtown Manhattan, near like Radio City Music Hall.
It's a really shocking case. And I think, the more details that come out, the more disturbing it actually gets.
It really is. It's like something out of a thriller. So picture this, it's the dawn. Thompson's walking from his hotel to a conference.
Yeah.
And suddenly, like, this masked gunman appears out of thin air, right? And this wasn't, just a mugging. Police are saying this was targeted, like the gunman was stalking Thompson before opening fire. Multiple shots. There was even a gun jam that the killer, fixes before running away.
Yeah, it's this, meticulous planning. That's what I think makes it so fascinating. It's not just an act of violence. Law enforcement thinks the suspect, who's still out there, by the way, probably has firearms training, they're saying the silencer, and possibly even having a bicycle already there to get away. So the police released photos from a hostel where they think the suspect was staying. And employees there said he always wore a mask, even in the lobby, like he didn't want to be identified. They also found a water bottle and a protein bar wrapper that they're testing for DNA. And get this, they're even tracking a bus that they think he took from Atlanta to New York last month.
Wow. It makes you wonder, what was the motive? Why would someone target the CEO of UnitedHealthcare?
Well, this is where it gets really interesting. So on the ammunition that the police recovered, they found the words deny, defend, and depose written on them. Does that sound familiar? It makes me think of that phrase, delay, deny, defend. It's what insurance companies are often accused of doing to avoid paying claims, basically wearing people down until they just give up.
Yeah. And we're not talking about just any insurance company here. This was the CEO of UnitedHealthcare, one of the biggest health insurance companies in the country. And remember, Thompson's wife said he'd received threats, possibly because of insurance coverage. Could this be someone who felt wronged by the company? Someone whose claim was denied, whose life was maybe even upended by these tactics.
It's possible. I'm sure the investigators are looking into that.
So we've got this high-profile CEO murdered. We've got this cryptic message that maybe hints at a motive. And we've got a company with a reputation for, well, aggressive tactics. It seems like the pieces are lining up.
Right. Definitely. Yeah, it's a complicated case. There's a lot going on, but we can't ignore the context, This isn't just about one crime. It's about healthcare in America and what companies like UnitedHealthcare are doing.
Yeah, that's true. It's easy to get caught up in the true crime part of it. But this feels bigger. There's all this anger and frustration with healthcare. And this case is bringing it all to the surface.
Exactly. So let's talk about UnitedHealthcare. This is a huge company, billions in revenue, and they're a major player in the health insurance market, especially Medicare Advantage. Do you remember what that is?
Remind me.
So it's a program where private insurance companies like UnitedHealthcare provide Medicare benefits, which sounds good, but it means companies can put profits over patient care. There was a Senate report recently that actually called out UnitedHealthcare for denying a really high number of claims.
So this is delay, deny, defend in action. People who need these programs are being denied coverage.
Yeah, unfortunately. And that's just one part of it. The U.S. healthcare system is for-profit, which means companies like UnitedHealthcare have a lot of power. They decide how healthcare is given and who gets it.
And when profit comes first, people get left behind. You hear stories all the time. People can't afford the medication. They have to delay procedures, even going bankrupt for medical bills.
It's awful. It makes you question. What are the priorities of our healthcare system? When profit is more important than people, that's when you get resentment and anger. Makes you think how many people have been pushed too far by these exact practices.
It's like we've decided healthcare is a product, not a right.
That's a dangerous way of thinking, and we need to change it. This case is horrible, but it's forcing us to look at the reality of a healthcare system that puts money first.
So what can we do? This feels so big. Where do we even start? I don't know. It feels like we're at some kind of crossroads, this whole case. The murder of Brian Thompson, it just shows how broken our healthcare system is.
Yeah.
Putting profits ahead of patients.
Yeah, and it shows the real cost of that. People are suffering, and we can't just keep ignoring it. We need real change.
But how do we even do that? It just feels so huge, so overwhelming.
Well, I think first, we need to change how we think about healthcare. We can't see it as a privilege anymore. It has to be a basic human right.
You're right. We wouldn't say that about education or public safety Why is healthcare any different?
Exactly. And there are other countries that are doing it right. They have universal health care, and it shows that we can provide quality care to everyone without bankrupting people
Oh, no.
or sacrificing quality.
I know, but people always say it's too expensive. It'll mean longer wait times.
I think that's mostly fear and misinformation. The truth is, a lot of universal healthcare systems are actually more cost-effective. They can buy in bulk, and they don't have all the administrative costs of a for-profit system.
So it's not just the right thing to do. It makes sense practically, too.
Absolutely. And it's not like this is some new, untested idea. Universal healthcare is working all over the world.
I guess it's easy to get lost in all the details of healthcare reform. But really, it comes down to human dignity, making sure everyone can get the care they need, no matter how much money they have. Maybe this case is awful tragedy. Maybe you can get people talking and spark some real change.
I hope so. We can't let this be normal. We can't ignore the people who are suffering because the system is putting profit first.
So what can our listeners do? How can they be part of this change?
I think the first thing is to stay informed. Don't let this case be forgotten. Learn about the issues, learn about the solution, learn about how the system is failing people, and then talk about it. Talk to your friends and family, talk to your elected officials, support groups that are fighting for healthcare as a right.
Yeah, it seems like a lot. But every voice matters. We've seen it before. When people demand change, things happen. They refuse to accept things the way they are. This case, Brian Thompson's murder, it shows a really deep problem in our society. And maybe we can use this moment, all this anger and sadness, to demand a better healthcare system, a system that's more humane for everyone.
I think we have to. We can't let this kind of tragedy be meaningless. We have to honor the people who have suffered by fighting for a better future, where healthcare is a right, not a privilege, a future where things like this don't happen anymore.
Well said. That's all the time we have for today. But this is a conversation that needs to continue. We all need to keep learning, keep talking, and keep pushing for change. Thanks for listening.